Hello, my name's Ji Young, and I am in charge of the first trimester of pregnancy. So the first trimester consists of week 1 to week 12, and that's around 3 months. So I'm going to be talking about what to eat during your first trimester. Preferably, you would like to eat some citrus fruits and spinach, and they're high in folic acid. Which also helps with the baby's neural tube defects. It prevents that, any cleft lip, cleft palate, and certain heart defects as well. Nuts, eggs, and beans are also high in protein, and it's something that pregnant women should be consuming a lot of. Asparagus and yogurt are high in vitamin D, and inadequate vitamin D can lead to abnormal bone growth, fractures, or rickets in newborns. Lean beef, collard greens, and chicken are high in iron, and you need to consume this to prevent iron deficiency anemia. So now I'm going to be talking about what not to eat when you're pregnant. Any uncooked seafood, and this is just because of possible contamination of bacteria, toxoplasmosis, and salmonella. Undercooked beef or poultry should also be avoided, and that's because of possible contaminations of bacteria, toxoplasmosis, and salmonella. Fish that has high levels of mercury should be avoided. Dry, uncooked sausages like pepperoni, bologna, foods of that sort should be avoided as well. Unpasteurized cheese should be avoided due to bacteria. It could result in miscarriage, stillbirth, or other serious health problems. Alcoholic beverages should be avoided during your first trimester due to the possibility of fetal alcohol syndrome and other developmental disorders. Unpasteurized milk and juice should be avoided, and more than 200 grams of caffeine a day should be avoided due to possible miscarriage, premature birth, low birth weight, and withdrawal symptoms of infants. So next I'm going to be talking about the importance of taking your prenatal vitamins. Every pregnant woman should start taking their prenatal vitamins once they figure out that they are pregnant. Prenatal vitamins consist of 2 nutrients, and that's your iron and your folic acid. Folic acid helps to reduce the baby's risk of getting neural tube defects, such as spina bifida, and it also helps to prevent your cleft lip, cleft palate, and certain heart defects as well. Most mothers-to-be do not get enough iron due to their pregnancy, so that can lead to iron deficiency anemia. So preventing iron deficiency anemia can reduce the risk of preterm delivery, low birth weight, and infant mortality. So you should take 1 prenatal vitamin per day, and this is what a prenatal vitamin looks like. And here's folic acid. And for these, you should just take it once a day. And here's your folic acid that you also need to take. And so for both of these, you should just take it once per day. So nutritional requirements during your first trimester of pregnancy, it consists of 60 grams of protein per day, 400 micrograms of folic acid per day, 10 micrograms of vitamin D per day, a slight increase of vitamin A, 5 portions of fruits and vegetables, and you do not need extra calories during your first trimester of pregnancy. Next, I'm going to be talking about some tips on alleviating morning sickness and nausea. So drinking small sips of water throughout the day can help with that. Eating smaller portions at mealtime with frequent snacks in between. Consuming more starchy foods because they are better tolerated in your stomach. You want to avoid overly fatty and spicy foods. Bland foods are better to tolerate. Foods that contain ginger may also help with your sickness. Drinking ginger ale, ginger biscuit, stuff like that. Getting up slowly in the morning can also help alleviate morning sickness.
Hi, my name is Kristen, and I'm going to be talking about drugs to avoid during the first trimester, expected changes to your body, and what to anticipate during your 12th week checkup. During the first trimester, the fetus is most susceptible to damages from substances like alcohol, cigarettes, certain medications, and illnesses. Some drugs that should be avoided include aspirin, ibuprofen, Sudafed, Pepto-Bismol, Aleve, and any non-prenatal vitamins. During the first trimester, pregnant women should also stop smoking and stop using any type of alcohol, including moderate exercise, a balanced diet, and adequate rest should help control the fatigue. Eating small and frequent meals along with ginger tea might help alleviate the symptoms of nausea and vomiting, but if it is severe, then you should contact your doctor to get a prescription for medications that can help with it. During your first prenatal visit, you will go through your personal medical history, including previous and current medical conditions, current medications, previous surgeries, family history, which will also include genetic disorders that you already know about, in order to determine the age of the fetus, to check the pelvic bone size and structure, and they will perform a pap smear test.
Hello, my name is Haben, and today I'm going to talk about what to expect during second trimester. So the second trimester is between 13 to 28 weeks, which is between 4 to 6 months. So during the second trimester, you'll be scheduled for monthly checkups, and during each visit, they will check your blood pressure and weight. You'll also offer to various tests and screenings, some of which include ultrasound, which is done at 20 weeks of pregnancy, and this is to visualize the baby's anatomy so that the doctor can see how the baby is progressing. You can also learn the sex of the baby by this time. A blood test to check your blood glucose level and iron level is done between 24 to 28 weeks. In every visit, the doctor will track your baby's growth by measuring the distance from the pubic bone to the top of your uterus. They will also listen to your baby's heartbeat and assess the baby's movement. And the movement usually happens after 20 weeks, and you will start to feel kicks and flutters. During the second trimester, your baby grows quickly and your body changes in many ways. The changes that you will see are breast enlargement, backache, weight gain, and since your body is stretching, you can have stretch marks. And for most of women, morning sickness will go away during this time. However, if you see these following signs like severe abdominal pain or cramping, bleeding, severe dizziness, and rapid weight gain, like more than 65 pounds per month, you have to call your doctor immediately. During the second trimester, you need to consume about an extra 300 to 500 calories a day, and you should eat healthy foods by avoiding foods such as raw meats, eggs, and fish. And most importantly, you have to continue taking your prenatal vitamins.
Hi, my name is Heather, and I'm here to talk to you about the third trimester of pregnancy, which includes months 7, 8, and 9. The third trimester begins in week 28 and ends around the 40th week of pregnancy. During this time, your baby is growing quickly, so you'll notice changes in your body, such as your tummy getting bigger. You'll have possibly Braxton Hicks contractions. You may see what we call varicose veins, which are larger veins, usually on the leg area. You may start to get stretch marks across your abdomen. You may have a lot more fatigue, being very tired. You may feel some heartburn. Backache is very common this late in pregnancy, along with potential urinary issues. So you may have to go pee a lot more as the baby lowers down and kind of presses down on your bladder. You may also feel your breasts becoming very, very full because they will be producing milk to help feed the baby when the time comes. And lastly, you may see some swelling of the feet, which is also very normal. During the third trimester, you'll see your doctor a little more frequently. So from weeks 28 through 36, you'll see your doctor every 2 weeks. And then starting at week 36, you'll see your doctor once a week until you deliver. Some important things to remember during the third trimester are to do your what we call fetal movement kicks or daily kick counts. And basically how you would do this is you will go into a nice quiet room, could be your bedroom, could be your living room on the couch. Make sure it's, again, a nice quiet environment, and you really want to focus on your baby moving. The goal is to count 10 movements in an hour. So if you count 10 movements before the hour is up, you don't have to keep going, but your goal is you want to feel your baby kick or punch or swish or move at least 10 times an hour. If you don't get to the 10th movement by the first hour, you can go to 2 hours, but if you have not felt your baby move at least 10 times within a 2-hour window, it's very important to call your doctor because they may want you to come in and be seen. Another thing to monitor during the last trimester is your weight gain. Ideally, you should not gain more than 10 pounds during this last trimester. One way that we encourage you to kind of keep your weight gain in check is to make sure you're staying active. So doing some light to moderate exercise. Swimming is great for pregnant women in the 3rd trimester. Some walking is great, maybe a little bit of light running, but not too much. You could do maybe some light weightlifting, but again, not too heavy. So ideally, when we're looking at 3rd trimester exercise, we're primarily focusing on walking and or swimming as well. Some warning signs that need to be looked at when you're in the 3rd trimester is the first one is preterm labor. So this is when you actually go into labor and your baby's less than 37 weeks along. So if you start to have regular contractions where you really feel your tummy kind of getting tight and you kind of feel that pain, if that is coming every 10 minutes and it's being very consistent, it does not change with movement, so lying down doesn't make it better, getting up and walking doesn't make it better. If you're continuing to have those pains and they're being very consistent and not changing with movement, then that is a time you need to call your doctor because they may want you to come in and be evaluated to see if you might be in preterm labor. Another sign or symptom of preterm labor, of course, is your water breaking. So most people think this is a big gush of water that comes out between your legs. That's not always the case. You may go to the bathroom and see kind of like a slow leaky faucet. So you'll kind of just feel dribble coming out. So it may not be a big gush. If you notice that you're leaking, you need to call the doctor, again, because they will probably have you come in to be seen. Other warning symptoms you need to be aware of: if you start to have severe headaches that do not go away, you notice your vision becoming blurry or changing in any way, you're gaining weight very quickly, if your hands and feet and face become really puffy and swollen, those could be signs of something we call preeclampsia, and it's important that you call your doctor and let them know so that you can be seen right away. And lastly, if you have any bleeding from the vaginal area at all, you experience a fever, specifically 101.5 or greater, you start to have very sharp abdominal pain, or you notice less or no movement of your baby, please call your doctor right away. And finally, some signs and symptoms that you are in true labor, not preterm labor, but this is greater than 37 weeks. So some signs and symptoms that you will see, and they kind of overlap a little bit. You'll have something called possibly bloody show, and that's just a kind of a stringy looking, kind of looks like egg white, but it's kind of pinkish tinted. You may see that come out as you progress towards labor, so just kind of be aware of that. Your contractions, again, will become regular. They will get shorter and shorter between intervals, so you may be having contractions every 10 minutes, and then they go down to every 6 minutes, and then down to every 3 minutes. Usually when your contractions are around every 5 minutes apart, it's probably a good idea to go ahead, pack up, and head to the hospital. And then lastly, your water breaking. I touched on that a minute ago when I was talking about preterm labor. So again, if you experience your water breaking or a nice steady trickle of water, then that is a very good indicator that the baby is on its way and you should get to the hospital.